That's correct. I teach courses on healthcare financing, bioethics, and I look at this whole issue from perspective of human dignity. That's been my focus. I think there is a lot of analysis of economic and financial impact of the current system and changes, but there's not enough attention paid to how does it really impact upon individuals and human beings and their families, whether or not you're talking about the system that exists under Obamacare before that or Republican proposals. And that's what I like to continue to highlight. What does this mean to real people? And what does this say about our values as human beings and as a community and as a nation?
Well, I mean, I certainly know what the word dignity means, but it's not often that you hear the notion of human dignity in the context of talking about healthcare, and particularly the debates that we're following from Washington. It seems like you hear no discussion about that really. Say a little bit more about that. Why do you think we need to understand what we're going to do as a country when it comes to healthcare from the perspective of human dignity?
Well, there's two aspects of human dignity that I think are really important to highlight. One is each individual's worth as a person in the community. I mean, when it comes down to it, we're as a species, we're distinguished from animals based upon our humanity. And that means that there's something about each person that has value. And when you move into the healthcare context, it also means you need to look at equality or equity. Because if I'm sick and I go to the doctor and I go to the hospital and they say to me, well, you have a problem, but we're not going to allow you to see our doctors or our nurses because you don't have enough money or you don't have insurance. That's not only a health consequence, but it's a dignity issue. It's essentially saying to me that the system is set up so that I, as a member of the community, am not worthy of getting the kind of care and treatment. The second thing is if I see another person walk in right behind me and they have first class insurance, Blue Cross and Blue Shield, and they're ushered in and then they're taken to specialists, not only do I feel that my personal worth has been devalued, but I say they're treating me differently. And that's what produces sort of a sense of dignity in the context of healthcare delivery.